Hello everyone, I am Dr. Devakant Mishra. I am a retina surgeon practicing at IQ Super Speciality Eye Hospital in Lucknow. My basic specialty is retina surgery, and I'll be talking about the most severe form of retinal disease today, that is the retinal detachment. Now, in the times of pandemic and when there's a lockdown or you're not being able to approach a doctor, this is one condition that needs immediate care, and you have to find a retina surgeon to take care of that. So retinal detachment, I'll be talking what retinal detachment is, what are the symptoms, how it can present to you, how you can prevent it in some ways, and what are the various forms of treatment that are there for retinal detachment. So as the name implies, it is detachment of the retina. So retina detaches from the position it is supposed to be in. There are various causes that could lead to this detachment, and the most common is trauma. So any injury, you need to rule out retinal detachment. If you are hit by a ball or you fall down and you hit your eye, or if you are in a road traffic accident, you need to get your eyes checked to rule out retinal detachment. Even small minor trauma like fingernail injury or injury with the fist can also lead to retinal detachment. So that's the number one cause. Number two cause is in cases of myopic patients. Myopic patients are people with high minus powers like -3, -4, and onwards. So all these patients have some weakness in the periphery of the retina, which is usually not picked up by general ophthalmologist or general doctors. So all myopic patients, people above the power of -2, need to get their retina checked thoroughly for the periphery, because there is something called as lattice degenerations. So these are weaknesses that are noted more in myopic patients. So these conditions are precursors to retinal detachment. So they can lead to holes in the retina, which can subsequently lead to retinal detachment. So these are the two most common conditions, first being trauma and second being people with minus numbers and lattice degenerations can lead to retinal detachment. There are various other conditions, but these are the two things that you should look out for. Now coming to the symptoms, how it is going to present. The number one thing there is that you can see small black dots in your eyes, which can also be seen routinely. So you don't need to get worried every time you see a black dot inside the eye. But if you see multiple black dots or multiple floaters inside your eyes, then you need to get your retina checked for retinal detachment. Then there is something called as photopsia. That is, if you see lights in your eyes, it's like lightning inside your eye or flashes of lights inside your eye, then that can also be a symptom. The most important symptom is that if you are having blurring, if you are having a symptom like a curtain falling in front of your eye. So a black curtain coming in your eye, coming in front of your eye is a definite indication towards retinal detachment. So these are the few symptoms that you can. So usually there is no pain associated with retinal detachment. So flashes, floaters, and a black curtain falling in front of your eye could be the most common cause of common symptom of retinal detachment. Now coming to treatment, if the floaters have just started, the flashing of light has just started, and you immediately reach your doctor or your retina surgeon. So at times we can help by just lasering that small area of weakness. But if that has progressed and the detachment is big, then we have to go in for a surgery. So there are various forms of surgery. The most common is something that is called as a vitrectomy surgery, where we go inside the eye and settle the retina. In that case, we have two options. Either we can put a gas inside the eye, which helps in keeping the retina together, or another option is for putting some oil, a silicone oil inside your eye. That also helps in attaching the retina. If we are going for a gas inside the eye, you do not need a second surgery usually. If you put oil inside the eye, then you need a second surgery to remove the oil. Oil gives us more control over the surgery. So if it's a big retinal detachment, then we prefer putting oil inside the eye so that It is under our control. Whenever we want to remove the oil, we can do that. These are the two forms of surgery. The other one being is a buckling surgery, where we put a silicone band outside the eye, which also helps in attaching the retina. So these are the three most common forms of surgery. Which kind of surgery you should go for, the decision lies with the doctor, the surgeon that is seeing you, and it varies from condition to condition. If anybody has retinal detachment or has undergone surgery for retinal detachment, you need to understand that it is at times difficult to give normal vision to these patients. Our number one goal is to maintain the structure of the eye and attach the retina. We may not always have excellent vision or vision as good as our other eye. So whenever there is a retinal detachment, we have to keep our expectations reasonable. The doctors try to give you as much vision as possible, and at least we try to give you vision so that you can lead your daily life, your normal activities. So these are the few things. So if all the symptoms that I mentioned, floaters, flashes, and a curtain in front of your eye, if anytime you see it, you should rush to a doctor. This is one of the very few emergencies that we have in ophthalmology in eye. So you need to get it and get it lasered, or if your surgeon feels that you need surgery, get your surgery done as soon as possible. Thank you.